What if some of the earliest warning signs of Alzheimer's disease appear years before major memory loss and are so subtle that most people dismiss them as normal aging? Welcome to Vital Drift, your trusted source for science-backed health, longevity, and wellness insights. When most people think of Alzheimer's disease, they imagine severe memory loss, confusion, or advanced cognitive decline. But Alzheimer's often begins long before those dramatic symptoms appear. In fact, the earliest signs may emerge gradually and quietly, sometimes years or even decades before formal diagnosis. Recognizing these subtle warning signs may improve early intervention, lifestyle adjustments, medical evaluation, and long-term planning. Today, we're uncovering the lesser-known early warning signs of Alzheimer's, the neurological changes behind them, how they differ from normal aging, and why early awareness may be critical. Let's begin. Alzheimer's disease is a progressive neurodegenerative disorder characterized by abnormal brain changes, including amyloid beta plaque, accumulation, tau protein tangles, neuronal dysfunction, inflammation, synaptic loss, brain atrophy. These processes often begin silently before severe cognitive symptoms become obvious. This means the brain may already be undergoing biological stress long before diagnosis. One of the earliest and most overlooked signs is subtle short-term memory disruption. This is more than occasionally forgetting where you placed your keys. Warning signs may include repeatedly asking the same questions, forgetting recent conversations, missing appointments more frequently, difficulty retaining newly learned information, relying increasingly on reminders for routine tasks. The hippocampus, a critical brain region for memory formation, is often affected early. Because short-term memory formation is particularly vulnerable, these issues may emerge before broader cognitive decline. Another under-recognized sign is difficulty with planning and problem-solving. This may include trouble managing finances, difficulty following familiar recipes, problems organizing daily responsibilities, struggling with multi-step tasks, reduced ability to adapt to new systems. This may reflect early executive dysfunction involving frontal brain networks. Tasks that once felt automatic may gradually become mentally exhausting. Confusion with time is another subtle but important clue. Individuals may forget dates, lose track of seasons, become confused about appointments, struggle understanding timelines, experience disorientation around schedules. While occasional forgetfulness can happen normally, persistent worsening patterns deserve attention. Language changes may also occur early. This can include difficulty finding common words, pausing more frequently in conversation, substituting incorrect terms, trouble following discussions, reduced verbal fluency. Some people may describe knowing what they want to say but being unable to retrieve the words efficiently. This may indicate changes in language processing neural networks. Mood and personality shifts are often overlooked. These may appear as increased anxiety, irritability, suspicion, depression, social withdrawal, reduced motivation, apathy. In some cases, individuals may lose interest in hobbies, social engagement, or activities they once enjoyed. These changes may reflect both neurological alterations and emotional responses to subtle cognitive difficulties. Importantly, Alzheimer's is not solely a memory disorder. It can affect emotional regulation and behavior as well. Spatial awareness problems may also emerge. This may include difficulty navigating familiar places, getting lost more easily, trouble judging distances, visual-spatial confusion, problems interpreting patterns. Some individuals may struggle driving routes they once knew well. These symptoms can be particularly concerning. Misplacing items becomes more problematic when accompanied by impaired retracing ability. For example, placing items in unusual locations, not remembering how they got there, accusing others of theft, inability to mentally retrace steps. This differs from simple occasional forgetfulness. Judgment changes may also appear. Examples include poor financial decisions, neglecting hygiene, unsafe driving choices, reduced awareness of scams, inappropriate social behavior. These shifts may reflect deeper cognitive processing impairment. Sleep disturbances are increasingly recognized as potential early contributors and warning signs. Research suggests poor sleep quality may both contribute to and reflect Alzheimer's pathology. Possible issues include fragmented sleep, excessive daytime fatigue, circadian disruption, increased nighttime confusion. Because sleep supports glymphatic clearance, the brain's waste removal system, chronic disruption may worsen neurodegenerative risk. Olfactory dysfunction or reduced sense of smell may also be an underappreciated early sign in some neurodegenerative disorders. Though not specific to Alzheimer's alone, sensory changes may warrant broader neurological evaluation. Now, it's critical to distinguish normal aging from pathological decline. Normal aging may involve occasional forgetfulness, slower recall, minor cognitive slowing, but generally preserved independence and functional capacity. Potential Alzheimer's warning signs often involve progressive decline, functional impairment, increasing frequency, behavioral shifts, disruption of daily living persistence matters. Risk factors for Alzheimer's include age genetics, family history, cardiovascular disease, diabetes, hypertension, chronic inflammation, poor sleep, sedentary behavior, smoking, social isolation, metabolic dysfunction. This highlights an important reality. Brain health is deeply connected to overall lifestyle. Preventative strategies may include exercise, blood sugar regulation, Mediterranean-style nutrition, sleep optimization, stress management, cognitive stimulation, social connection, cardiovascular protection. While these cannot guarantee prevention, they may significantly influence brain resilience. The concept of cognitive reserve is also crucial. Lifelong learning, reading, problem-solving, education, and mental engagement may help the brain better tolerate pathological changes. This means protecting brain health begins long before symptoms arise. Early medical evaluation is critical if concerning symptoms develop. This may involve neurological exams, cognitive screening, imaging, biomarker assessment, laboratory workups. Because some symptoms may stem from reversible causes such as vitamin deficiencies, thyroid disorders, sleep apnea, depression, medication effects, not all cognitive decline is Alzheimer's. Early detection creates opportunities. Even though no definitive cure currently exists, earlier recognition may allow lifestyle optimization, medication interventions, safety planning, family preparation, improved support systems, clinical trial access. The emotional burden of Alzheimer's is immense, not only for individuals but for families. This is why awareness matters so deeply. Ignoring subtle symptoms out of fear may delay valuable intervention. The key message is this: Alzheimer's disease often begins quietly. Its earliest warning signs may not look dramatic, but subtle shifts in memory, language, mood, focus, judgment, and daily function can signal deeper neurological change. Recognizing these patterns early may empower individuals to seek answers sooner, protect brain health more aggressively, and plan proactively. Your brain is your identity, your memories, your relationships, and your life experience. Protecting it should be a lifelong priority. Thank you for watching Vital Drift. If you found this video valuable, make sure to like this video, subscribe to the channel, and turn on notifications for more science-backed brain health, longevity, disease prevention, and wellness content. Share this video with someone who may benefit from understanding these critical early warning signs. Early awareness can change everything. Stay informed, stay vital,